Hello, everyone, and welcome to Chapter 10, where we're going to talk about documentation in the medical records. So, we're going to cover a lot about SOAP notes today and give you a good idea of what the APTA, the American Physical Therapy Association guidelines are for documentation. We're going to discuss the elements, so the S, O, and A and P in the SOAP note. What's included in our documentation. This can be um, uh, progress reports, discharge reports, weekly assessments, all of those things. So let's get started. Um, so why do we document like we do and we use a SOAP note and we have to document everything we do? Well, there's a couple reasons. Reimbursement, insurances want to see that we're making progress with our patients, and the way to do that is through a SOAP note. It assures the quality of care of our patients and makes sure that we're following standards that we need to. It provides a good continuity of care. So meaning the next person that's going to see this patient knows exactly what they did the day before. Legal reasons. If I always say, if you didn't document it, it didn't happen. And if something comes up, the patient gets hurt later on down the road because of an exercise you did and it wasn't documented, then we can be in some trouble. And then it can be a marketing tool. So what do we need to make sure we're doing when we document? Well, we need to make sure it's legible, especially if we're doing handwritten documentation. It needs to be in blue and black ink, and errors need to be corrected properly, meaning if it's written one line through, initial and date with the corrected word above that crossed out line. We need to make sure that everything's documented, meaning all sessions. We need to make sure that informed consent is documented, meaning that we have put into our note that the patient agreed to getting treatment. Always we have to date and sign every single note that we have with our designation, so PTA or student PTA. And then any student note needs to be co-signed, and you'll figure this out in your clinical settings that your CIs will have to co-sign your notes. Any cancellations or no-shows also we have to document. Here I have linked the rules with the laws of what is adequate documentation in the patient records if you want to go look at the rules and the laws and the ethics of documentation. So medical records may include the following sections. There's so many different sections. It can be progress notes, discharge notes, the intervention plan, any kind of data, any kind of height, weight, medications. There's so many different parts of the medical record. You're going to see once you get out into clinical rotations that some of these medical records are very lengthy and long. So part of our physical therapy documentation, though, we have our initial eval, which is done by the PT. This is where they set goals and plan of care. We also have each of our daily notes, which is our encounter notes or our visit notes. This is the daily interventions that we give to our patients. Then we have our progress reports. This is usually done weekly just to capture how the patient is progressing towards those goals. And then we have our discharge report. This is done by the PT typically, and this is upon discharge when they're getting ready to discharge from physical therapy services. The PT is signing off, stating that they met those goals and all of those things. In the evaluation, we are really working on setting those goals as the PT is, I should say, not we as PTAs, but the PT is setting those goals, taking range of motion, taking MMT scores, seeing what we need to work on with the patient, and setting the goals and the plan and care accordingly. In this process, they get a patient history, basically trying to get an overview of what's happened in the patient's medical history so we can better understand how to treat the patient. Our treatment notes these can be written by PTs or PTAs. These are generally shorter than the eval, and this is typically written as the SOAP note format, which we're going to go over here in a minute. This is what SOAP stands for. S is subjective, O is objective, A is assessment, and the P is the plan. Now let's get into a little bit more detail of what these each mean. Our progress reports are written by the PTs only. As PTAs, we're not allowed to write progress reports, but these are where we're making sure that the patient is working and progressing towards those goals. So the PT will look at the goals and see where they're at to reach those goals. And maybe they might need to modify the plan of care and the goals. The discharge report, this is like we talked about, happened on discharge. This is where the PT assesses those goals again to make sure the patient has met them or maybe not met them. Our subjective, so the first part of our SOAP note, the S, this is where we are getting our patients' complaints of pain. We're asking subjective questions that relate to their goals so that we can get a better idea of how the patient's doing subjectively overall. Our objective part of our note. This is where I always say is the bread and butter of our note, because this is actually the interventions that we do. So not only are we saying the patient performed 2 times 10 bicep curls with a 2-pound weight, but we're also in that objective measurement saying why we did that. So in that case, it would be to increase bicep strength, hopefully to improve ADLs or something like that. So this also in the objective could be our measurements that we take. So our range of motion measurements, our MMT scores. This could be any kind of interventions like balance exercises that we do and things like that. Our assessment, the A in our note, this is really where we are letting the therapist know how the patient's progressing towards their goals, short and long term, and their response to the intervention. So did they have pain with some of the exercises? Did they need frequent rest breaks due to fatigue? That would all be something that we might want to put in the assessment portion of the note. Now the P, the plan. This is where we are going to state what our plan is for the next treatment session so that the next therapist coming in has an idea of what this patient needs to work on. So this could be as something as next time try to increase the weight during the bicep curls to increase strength further, or something along the lines of that. Or it could be as something as next session, attempt stand pivot transfer versus a lateral transfer because patient improved on lateral transfer this session. So it can be something that we want them to work on for the following session. Legal issues and documentation. So the reason that we need to document everything is because that is what, if anything happens like a lawsuit, our legal teams are going to come back to our documentation to see that we had everything documented that we needed to. So not only do we document just to let the therapist know what we were doing for insurance purposes, but we're also kind of documenting to save our own butts just in case something legally happens, that we have it documented. So this really is just stating that we need to make sure we are putting our title after we sign anything, and that it should be a PTA after your names, and your credentials should be listed clearly. So as you are going into your clinical rotations, you will actually be putting SPTA because that stands for student. But also there's other credentials you might see after PTs and PTAs. So some people are NCS, which is a neuro certification specialist, where you might see like Dr. McCann. She has Dr. McCann DPT and NCS, meaning she's a neuro certified specialist. So you might see other credentials like that off of other people's PTs and PTA credentials. We always want to make sure that our documentation is defensible. Like I said, you might need to be using your documentation in legal terms, and we need to make sure that everything was documented, but not only that, that it clearly stated what you did in the scenario. So if there was like an emergency situation and someone passed out on you, you want to clearly state that you lowered them to the floor, that you took vitals, you made sure there was no injuries, you called your supervising therapist, all of those things just to make sure that your documentation is defensible if anything were to happen to that patient, maybe the following week because of the fall. Computerized documentation is really where the industry is going. Actually, it's even going further than that, and some facilities are doing AI documentation. So it's all done electronically in an electronic system. This actually does maximize efficiency and helps with billing and submits information all electronically to the electronic medical record. When I started 15 plus years ago, it was handwritten. Now we are all computerized, and now we're taking it a step further where in some clinics you wear a mic and it records your entire session and it plugs it into a note for you, and then you audit the note. So it's come a long way. Just know that, especially you getting out into the career, you're going to have to adapt to whatever clinic or facility you're working at and what their documentation system is, because everyone has it a little different. So part of your assignment for your discussion board this week is to watch an eval and then write a SOAP note on it. So you will be doing that and submitting it. I hope you enjoyed my lecture on documentation. Hope you have a great day. Reach out with any questions.